Well, welcome, ladies and gentlemen, to another session of Healthcare Reform 2.0, the only podcast in the world for people with curious minds and a desire to have a better healthcare system. I'm joined today for this episode 1.2 with my partner, Tim Henning. And Tim is a little bit of a Where's Waldo today because he's out traveling, so we'll find out where he is. And we're going to be talking a little bit about where we've come from in healthcare, from the Mayflower to medical mayhem. And Tim has joined us. So hi, Tim, how you doing? And where the hell are you?
Hey, Tom. Well, I'm in lovely, windy, cloudy Cabo San Lucas, sitting on a 2,000-foot cliff overlooking the Pacific Ocean. Got to see some great whale activity yesterday. They were breaching and everything as they come up and down the coast here. So that was fun to do. And so get this. So yesterday, I'll tell the story a little bit later in the episode, but I went down to the local pharmacy here and I picked up my 2 blood pressure medications. And guess what? They're 1/4 the price of my copay back in California. It's the exact same product made by the exact same manufacturer. And while I was there, I picked up some Cifro just to have that on hand too. So it's an amazing thing about Mexico. I don't have to go get a prescription and pay my copay, and they bill my insurance to get my prescriptions.
Well, and Mexico doesn't have federally mandated drug rebates. That's number one. And that cuts a big chunk out of that price, which almost no other country does have these mandated rebates that have to get paid. And while those rebates aren't assessed directly against a drug that you're buying through your insurance or out of your pocket, they do inflate the price because they are levied on the average wholesale price and they affect the average retail price that gets charged for the medication. You know how that works. But I ought to send you some things I need while you're down there, because as we've started to get to this senior citizen status, those kind of things like drug copays are starting to go up and up. But one little piece of advice for our listeners: if you check with most of the drug manufacturers, they have what are called patient assistance programs, and you may find that you're eligible to get lower prices or even in some cases have your copays waived for some period of time. The reason drug manufacturers do this are varied, but you should always check to see that, because there is sometimes a way to get some of your cost out of pocket lowered by these what are called patient assistance programs.
Yeah, that's a good point. I'm glad you brought that up. We'll go into that more later. I thought we'd start today just a real brief, high-level recap of Episode 1. Episode 1 was the kickoff of this series. And we talked more or less where we are today. The quagmire that we're in, it's not a system, it's a non-system. That's what I'm calling it from now on. We talked about list price versus real price. And we talked in general about the hostile economic environment that we find ourselves in. As patients, we find ourselves in the kind of caught in the crosshairs and crossfire from hospital versus hospital, doctor versus doctor, and the list goes on. And in the middle, and we'll go over that in a minute, we're all the ones just sitting there looking on the outside and going, what is happening here? So I don't know if you want to talk any more about where we left off, but I wanted to give our listeners an idea of what happened in that episode before we jumped into the beginnings of this healthcare system from the Mayflower.
Well, in the last episode, we kind of covered what you said. We talked a lot about the system and what a mess it is. And we are going to start to unveil how we got to be such a mess by going through some of the history. It's kind of interesting to take a look at where we are in healthcare today and go back through time to find out how we got the things that we have today that we consider this healthcare system, which, as you say, is a non-system. We also talked about the difference between pricing of healthcare that may appear in the press or may be on an invoice and the actual pricing of healthcare based on what is being paid for those goods and services for the most part. We talked about it as being a collection of self-predatory practices that were put in place to solve the needs of one or another of all the individual players in the systems. Programs were developed for doctors, programs developed for nurses, programs developed for hospitals, programs developed developed for insurance companies, and a series of laws and practices that would have put in place at various times to continue to solve those equations. So that's kind of what we talked about in the last episode, and it laid the groundwork, I think, for where we're going to go today. The next couple episodes are really going to be focused on how do we get to understanding how we have the system we have today. We're going to start with how the system developed, and you will see that many of the things that existed back at the beginning of this country, many of the things we put in place to manage healthcare haven't changed as much as we think they should today.
Exactly. Well, I think let's get started. I'd like to start the episode with a quote. This is from a Dr. Donald Berkwick, in a speech to the Institute of Healthcare Improvement. And we'll be talking more and more about Dr. Berkwick in the future, because you're going to see him emerge as one of the few voices of reason as we dive more deep into what's happening here with this non-system. So let me start with the quote from Dr. Berkwick. This is coming from Money-Driven Medicine by Maggie Meyer. Quote, "The enemy is disease. The competition is against disease, not one another. The purpose is healing, yet in the storm of the healthcare crisis, it is easy to forget why we trouble ourselves in the first place. It is easy, frighteningly easy, to become trapped in the sterile thesis that our true deep purpose is to gain and preserve market share in a vacant terrain of others whose purpose is precisely the same." End quote. In other words, it's all too easy to forget the patient.
That it is. And the patient is completely ignored throughout this entire system today. The patient sits there. He or she is not part of the loop in terms of communication around their health care. When an insurer steps in, as they do most of the time, or Medicare or Medicaid or a federal program, the patient's completely removed from the basic dynamic of what's happening within the system. And as a result of that, it's gotten to the point where it really does feel like, from the patient's perspective, no one is there helping me or anyone. And it's true. I mean, no one is really focused on helping the patient, other than trying to improve healthcare becomes the underlying cause of what they're doing. The most important other piece of this equation is many physicians, when they're going to medical school, get into practice because they want to help people. They want to improve the lives of people. But the underlying processes that happen within healthcare over time tend to pull the physician out of that dedicated to care mode and really have to get focused in trying to manage a business that, because of the mess that we have in the system, is almost unmanageable.
Exactly. And we'll have more information from his own life experience with his wife. I'll have mine. When you go in to get healthcare, you better have an advocate there for you, because if you don't, I'm afraid that you're going to get lost in the quagmire. So let's start from the beginning, the period from 1492 to 1849. Health in the New World, and hospitals and physicians, never the twain shall meet. This is going to be an interesting discussion, because most people, I don't think, have a understanding of what differences were between the hospitals, physicians, and doctors. They were separate things back then. So let's start in 1492. During the first winter in the New World, 45 of the 102 immigrants died. Only 53 settlers were alive in November 1621 to celebrate what we call today Thanksgiving. Of that, only 4 adult women. By the way, these are from your book. The average life expectancy at that time was in the early 30s. Smallpox, pneumonia, scarlet fever, rickets, cholera, influenza, and plague. Again, from your book, quote, "The practice of healthcare, after all, is largely a war with other species, bacteria, viruses, and other complex pathogens. A war with the environment, accidents, violence, pollution, and also a war with ourselves, diet, exercise, work habits, sleep, and behavior." And by the way, being around the pool here in Cabo and going to the buffet, I can see why diet is the main problem for most people. Continuing, note the quote, "From time to time, we see gains for ourselves in these battles. but our mortality assures us that we will all eventually lose the war. Basic biology and the laws of nature have stacked the decks against us. Innovations in technology, science, and medication help many of us delay the day of our ultimate surrender. But these advances have also fostered the false belief that no price is too high to pay for an extra day or an extra week of life, end quote. So Tom, what was the number one epidemic in recent history that killed between 25 million and 100 million people worldwide?
Well,
I know you know the answer.
The answer is the Spanish flu. Spanish flu happened between 1918 and 1919, and there, depending upon the estimate that you see, there were between 25 million and 100 million people died worldwide as a result of the Spanish flu. That's about 5 times the estimate of World War I deaths. There were 500,000 people alone that died from the Spanish flu in the U.S. Today we have our own flu epidemics, but they haven't hit us quite as hard because we have learned how to help treat people and keep them alive. They're not dying from the flu. But in not dying from the flu and growing up to have children, they're becoming able to pass that susceptibility to the flu onto their children instead of having the species get stronger. So we are getting more and more susceptible to these diseases. We've had 97 pediatric deaths so far this year around the current flu epidemic, which is the H3N2 virus. And this year, the issue with the flu virus is it's not very effective. In fact, if you track flu viruses over the past few years, they've become less and less effective over time. And there's a reason for that. The reason is, as we have been creating vaccines, we've been selecting ourselves to get weaker, as I said a minute ago. But at the same time, as we attack these species with our own form of biochemical warfare, they are reproducing faster than we do, so their generations happen quicker, and they are becoming more and more rapidly mutating. It's their own survival strategy. So as time goes up, this is becoming a bigger and bigger problem for us as a species and us as individuals, because vaccines are going to become less and less effective, with rare exceptions, and we are become more and more susceptible to these diseases that we wouldn't necessarily have gotten as sick from in populations in the past. Yes, there were epidemics that wiped out large sections of the population, but oddly enough, they strengthened the following generations of people that came along. I'm not arguing, as Mr. Zobrist does in Dan Brown's book Inferno, that we'll talk about in a future episode, that we should force some kind of a plague upon America or do something like that. But we need to recognize that part of the reason care is going up is because we are treating ourselves, and that treatment is making us weaker and making the things that attack us stronger.
Exactly. I'll give you a good example of me going to get my blood pressure meds filled because I was leaving the country, and they said, no problem. So they called me back 2 hours later and said, well, you need to come get your blood pressure checked. I called her up. I said, last time I was in that office, there were 22 people with face masks on, and you got a flu epidemic going in there, and you want me to come in there just to pay $20 to have my blood pressure test when I check it every morning? No, thanks. I'll be in Mexico. I'll buy them there. So another example of why I would have to go back in to have my blood pressure test for them to prescribe something so simple as this. So it's another example of waste in my opinion. So let's go back to our forefathers. For several centuries after Columbus, well into the 1700s, 15 to 20% of those who came to the New World would perish. In 1776, the population of Philadelphia climbed to over 40,000. And it was a melting pot of disease. I also put a piece in here from your fictional Bonnier you start in your chapter, and this is a quote and I think those bring to life for me some of the things that people were experiencing back then. So your quote on this one starts out with you spent 19 years fleeing disease and pestilence across Europe, only to arrive in the land with even more sickness at your heels. For you and all the others, the daily struggle for survival is a simple fact of life, and will largely remain that way until the birth of your great-great-great-grandson in 1872. Not many will feel well most of the time, end quote. Tom, can you describe a little bit from your research and, of course, that the very beginning section of your book, what it must have been like in that period of time for many people that had just come here and are struggling to survive?
Yeah, the basic issue that you have when you look historically back at the birth of America, I think one of the things we don't recognize is many people came to America in that time not as much because it was a land of opportunity. That was part of the equation, but also life in Europe at that point in time was not that pleasant. There were many plagues happening in Europe during that period. There was disease, there was pestilence, they didn't have very good sanitation. The overall environment was not good. If you look at the time that America was founded, even up to through the settlement of Virginia to the Pilgrims to the settlement of Maryland, England had been involved in wars for hundreds and hundreds of years. Their economy wasn't very good. Life there was pretty hard. So most of the early settlers left Europe to come here for one reason or another. Overall, the thing is, when they got here, early settlers in America, they faced numerous diseases. You know, they had gone to sea. Typically, they weren't in the best of health to start with. They didn't have a huge knowledge about how to really survive in a completely new world. There was a fundamental lack of knowledge about things like basic sanitation. They knew nothing about germs or epidemiology. They didn't know anything about how to control infectious diseases. And when they got here, many of them perished, and they died in transit. 20 to 30% of the people that left England in a ship to come to the New World didn't make it in many cases. And then when they did get here, they were often full of other problems from other diseases they picked up on the way, or they may have had things like heavy metal poisoning, either from the medications they were prescribed on the ship to treat certain diseases, or from ergot poisoning, which was common in Europe. Ergot is a fungi that infests wheat and causes mental illness and problems. But many of the people that were going over were also workers and ship workers, and some only signed on to be on the ship for the voyage. So it wasn't a very good place to come to. The second part of the problem was there wasn't a lot of ways to treat disease. The understanding of healthcare was limited. Most of the things that we looked at in healthcare in those days came from 300 BC. They understood that health was driven by what they called 4 basic humors, and those humors were the various fluids in the body: black bile, yellow bile, blood, and other of these humors that had to be in balance. And some of the treatments that existed at that time were just laughable. If you had scarlet fever, they would have you sleep in a bed surrounded by scarlet drapes that would help protect you from getting the vapors that were making you sick. When you did get sick, the few drugs and chemicals that they had to treat were often based on heavy metals like antimony and mercury and other things that were actually poisonous. So they were all about what were called purgatives and cathartics that basically made you evacuate your bowels or evacuate your intestines or your stomach through various ways of getting it out of your system that had little to do with anything pleasant, and really didn't do much to the chemical absorbed in the blood. And the other thing we'll talk about in a little bit is about bleeding. That was another major way to deal with getting these 4 humors back in balance. It was either you didn't have enough of a humor or you had too much. So in general, it was a crapshoot to come to America, and when you got here, many people were dying because they had little to no way to treat the disease, and the treatments that they did have were often much worse than the disease itself.
Well, that takes us to a good segue here, because I think that would bring us to fast forward to December 14th, 1799, and the retired former president, first president of the United States, General George Washington, woke up with a sore throat. What happened then, Tom?
Well, that's a good story, and then we have another episode that'll talk a little bit more about that in the future. But George Washington, our first president, was retired, and he was living in his home and living a fairly comfortable life. And he went out one morning riding, as he did often, to take a look at the management of his estate. And when he got back, he was chilled through. When you ride on a horse and you get sleet and snow and rain, it eventually works through until you're very, very cold. So when he got home, he was chilled. One of his people said, "You should really go up." He had gone to bed, and the sore throat was starting to become more and more of a problem. By early in the morning, his wife was concerned because he was having a hard time swallowing. Now, we've all had sore throats and we've had hard time swallowing, but he was having probably a strep throat. We never will know exactly what it was because they didn't know anything about disease and germs at that point. But he ended up waking up in the morning, and it was even worse. He was having a hard time swallowing. He was having a hard time speaking. Life was getting very unpleasant for General George Washington. So his wife said to his secretary, "Please go get a doctor." So they called a doctor first, the family physician. And he lived a bit away, and it was a cold winter day, snowy day, but he wasn't there right away. So the secretary also ordered another physician to come who was a little more local. While they were waiting for the two physicians to get there, because remember, this was horseback, it wasn't cars, it wasn't trucks, to ride 10 or 20 miles took a while, they brought the overseer of the farm who came in, and the general's instruction was to bleed him. So he bled him, which was the treatment of the day for things like sore throats and fevers. So the overseer came in and they bled him by making some incisions in his arm, and the general was bled of some unknown amount of blood, and the first doctor arrived. When the first doctor arrived, the one that lived locally, not the family physician, he was concerned because the general's condition had not improved. So he ordered another bleeding of, I believe, 12 ounces of blood. They bled the general again, and they waited a little bit of time, and the general didn't improve. By then, they had called another set of physicians that were local physicians, and another physician showed up. And the other physician comes in, and the two doctors discuss the case again. This is about an hour or two later. The general's still not improving, so they now bleed him again of 32 ounces of blood. If you do the math on this starts to get concerning. So a little bit more time goes by. The general is still not improving. Finally, the family physician arrives. The three now sit and discuss it, and they decide to bleed the general one more time of another 32 ounces of blood. And they do. And the people that were in attendance at that third bleeding noted that the general's blood was not running very freely. Well, it probably wasn't running very freely. They had bled him of well over half of the volume of blood in his body. And if you add in what the overseer bled, which we don't know, but if you take the actual numbers, he very likely died from blood loss, not the sore throat. That'll give you an idea of the effectiveness of our healthcare system in 1799.
So there's your tidbit for everyone listening. If you go to a cocktail party or a dinner party, ask people at the table, how did George Washington die? And they'll tell you he fell off a horse, he got shot, whatever it is, but that's the true story. So
or you'll hear some people say he died of a sore throat, which was the kind of official death certificate. It is a good coffee table discussion point. And don't forget to ask physicians. Ask lots of physicians because they may not know themselves.
Well, this will bring us to another piece in a second about what kind of physician they think they are. I think it's interesting at this time we had these different things you described. And unfortunately at that time too, religious doctrine did drive some of the science. And so, but keep in mind that some of these things still linger on. People today still wear copper bracelets. They still believe in magnet therapies, and many people, especially sports people, I think a lot of baseball players wear titanium threaded necklaces. So there you go. Get yourself a titanium threaded necklace and you'll just be fine. Won't be a problem. Also, I just want to make sure people understand during this period, because now you're talking in the middle 1800s, there were some advances. The stethoscope was invented, the microscope was invented, we started to get into germ theory, which you brought up before. Then we started with antiseptic principles, because it wasn't until, I think, the mid-1800s, maybe into the early 19s, that we were applying these principles. And this time came the emergence of the three types of physicians. So talk a little bit about that, Tom, the difference between doctors and physicians and these type of doctors that emerged at this time, and then how they were pretty much checked by one group with the development of the AMA.
Well, you run into the issue of when you get into the 1800s, and you go from the early 800s to the middle of the 1800s, private physicians were the main people that took care of people. They saw wealthy people in their home. They treated the sick, poor that worked for them, indentured servants that worked for them, and it happened in the home. And as you said, by the late 1700s, the amount of disease that was occurring on the shore, immigrants coming into the country, indentured servants, frankly, who were coming here to work for the landed gentry, the people that owned homes or owned businesses. When they got here, as I said to you before, 20 to 30% of them died on the voyage going over. And many of them, up to 50 to 60% of the ones that finally got here, couldn't work. They were either too sick to work, or they had some form of a mental incapacity due to mercury poisoning or lead poisoning or something else that they got on the voyage. Or they were now pulling people from all kinds of nations, not just Europe, other countries as well. And since they had lived in these small enclaves in towns and villages and didn't intermix very much, their immune system wasn't as capable of dealing with the same diseases that existed in Africa or existed in other parts of Europe. They just didn't have those immunities. So by the time they got here, many of the indentured servants were sick and couldn't work. The second part of the problem was so many people were coming here that there was a quote from Ben Franklin, and I don't have it in front of me, but he basically said Philadelphia was little more than a melting pot for all the races to come together to infect each other, and it was causing a huge problem. So the physicians that practiced medicine of that day, we now call allopathic physicians. Their basic belief was in providing some form of medication or what they called heroic treatment, which usually involved cutting or bleeding or something that was cathartic or purgative to the body, all of which were exceedingly unpleasant and painful. Most of which, as we said, didn't work. The basis that they had for these things came from science that started in the 300 BC era and only started to get modified in the early 1700s and 1800s. But as you come into the middle of the 1800s, physicians, private physicians, the people that had been treating most of us, were coming under fire. They used to work with people called apothecaries, and they used to come up with these concoctions of things that were mixtures of things like basil and chickweed and dogwood and primrose and holly and honey and extracts from sycamore and dill and things that existed in a medicine cabinet. And the physician would write down a prescription for an apothecary to compound a poultice or a tea that a person would take. But as you come into the middle of the 1800s, you now have the advent of a druggist, and you have patent medicines coming in. Plus, people were getting really sick of being bled and being made to vomit and induced diarrhea and all these other nasty things. And they were looking for other forms of care. So 3 new schools of medicine started to arise. One of them was called homeopathic, and we're familiar with the term homeopathy today because it was really about trying to take a preventative measure and use good diet and some things on the early end in small doses to help you strengthen your body and become less susceptible to disease. And that started, surprisingly, at Hahnemann Hospital in Philadelphia. Hahnemann is now a staunch defender of what is called allopathic medicine. We'll talk about why in a second. The second thing that happened is the druggists were coming on. There was also osteopathic medicine, and then there was another form called eclectic. And eclectic was a little bit of a combination of homeopathy and allopathy. And they kind of sat in the middle. But frankly, in the early 1800s, the dominant form of treatment was really becoming homeopathic, with institutions like Hahnemann Hospital starting to become the birthplace of this kind of treatment. And it was the death knell was starting to ring for allopathic physicians. They were losing money, they were losing patients. They were also being undercut by the new druggist, because the apothecary who was doing the compounding now had people coming along that were called druggists who just sold patent medicines. And these patent medicines, while they didn't do much in terms of cure, they made you feel pretty good because they were largely made up of cocaine, morphine, and alcohol in some combination, often with some really bad tasting extract of vegetables and plants that gave it a bad taste. And the bad taste was important because at that point in time, unless it tasted bad, it became believable that it wasn't good for you. So you had a number of patent medicines come into the world, called Daffy's Elixir and Dr. Lee's Bilious pills and others, that people were using to self-medicate. And frankly, it was driving the private physicians out of business. And then the last blow came right in the middle of the 1800s, which was the birthplace of hospitals. As hospitals started in the 1780s and 1790s, with one of the first hospitals was Philadelphia Hospital, founded by Ben Franklin and a Dr. Dunn from Maryland. Hospitals were the places for the sick poor to go, the indentured servants to go. Rich people didn't go to hospitals. Massachusetts General Hospital, an insane asylum, was formed in the 1790s and early 1800s. By the way, it was also Massachusetts General Hospital, Life Insurance Company, an insane asylum. The life insurance company we can talk about on another episode, how those three things played together. But the physicians were being held under fire. There was a quote in the book from some meeting minutes of one of the associations of physicians of the day, where an allopathic physician said, "I am really not able to keep my practice going due to the economics of the situation." So the AMA was formed to gain control over healthcare. And between 1760s and 1900, allopathic physicians took control of licensure of medicine, got new patent and trademark laws approved by the U.S. government so that they could have a federal statute that allowed them to go after people competing with them. The same thing with patent medicine makers. And by the early 1900s, you didn't have homeopathy, you didn't have osteopathy, and you didn't have eclectic practice anymore, because they had gone state by state and gotten states to pass license laws that said you couldn't be a licensed physician unless you went to an institution that met these kind of standards. And oddly enough, those standards had nothing to do with being a homeopath or an eclectic physician. And furthermore, they started to get into the position of licensure. So since the allopathic physician was the only one licensed, the hospital who was treating the sick poor didn't have physicians. They weren't allowed to practice in the hospital. So the doctors worked in hospitals. And I know today that's confusing because we call a doctor and a physician the same thing. But in the 1800s, they were not the same occupation. Doctors treated the sick poor, and they were trained to help the sick poor kind of go from being sick to being dead, and not infecting the population and not upsetting the household of the person that they were an indentured servant for. And the doctors didn't really pose a threat until the early 1860s, when two things happened. Number one was the development of ether as a way to have painless surgery. Prior to ether, surgeries were quick and barbarous and often very dangerous and deadly. And as a result, not many physicians did surgeries. You went to barbers to have that happen. But number two was the birth of the understanding of the core of what a germ is. And Joseph Lister wrote a book called On Antiseptic Practice that changed the nature of medicine. Prior to that, if you had a minor surgical procedure, you had a fairly high percentage of chance of dying of infection. After Lister, that was reduced from about a 20% chance of dying, in some books it says 8%, to about a 79 to 80% chance initially of surviving surgery. So antiseptic practice became the rule of the day for allopathic physicians and, frankly, doctors in hospitals. So how did doctors become the threat to the allopathic physician? Allopathic physicians couldn't easily use ether in the sick room in your home. And they couldn't use the carbolic acid that was the root of antiseptic practice of the day, because the carbolic acid would be sprayed across the field to help get rid of the germs. Carbolic acid also damaged fine linen, damaged floors, caused all kind of problems. So where was a place that procedure could be used? It was in the anatomical theaters of the hospitals where doctors were being trained. So between 1860 and 1900, the wealthy people that wouldn't be caught dead literally in a hospital now wanted to go to a hospital because they could have painless surgery and have less of a likelihood of dying from treatment. Hospitals became the rule of the day. The allopathic physicians created the AMA, and the AMA's charter was to preserve the business of allopathic physicians. And they fought battles after battle after battle, and by the early 1900s, they had wrested control away from hospitals and doctors into the hands of physicians, and physicians couldn't charge for services in hospitals. But by 1912, they were allowed to charge for services in a hospital. So today, those two words are interchangeable, and if you talk to most physicians, they won't even be able to tell you that a doctor and a physician was a different practice. It's not something that they talk much about. But that's kind of one of the things that brings us to where we are today.
Yeah, I think that's right. You talk to most physicians, they wouldn't be able to even explain any of this, much less, what kind of physician they would be considered. Obviously, something that the AMA, I gotta give the AMA credit, they did a hell of a job, protecting themselves. And we'll get more into that when we see what they've done even through today. However, they've lost a lot of prestige. Most of the physicians I talk to are not members. Most of their membership, I believe, I may be wrong, are a lot of new physicians coming in or people that are in medical school. And there's a fair amount of outrage, at least in the circles I'm in, from physicians who are not happy about what's going on with the AMA today. I don't know if you want to elaborate on that, but I've seen it, I've seen this occur now in the last 5 or 6 years.
Well, the AMA's had a storied history, and when the AMA first started, it wasn't alone in this thing of aggregating a group that was under economic pressure together. You had the patent medicine people of the day who were taking control, and we're going to do a whole show on patent medicines. But you had patent medicines, you had the legal profession that was starting to unite at that point in time. And if you look at the mid-1800s, you start to see things like the American Bar Association gets formed, the American Medical Association gets formed. You see what was initially called the Proprietary Manufacturers Association gets formed, who was the core group of patent medicine makers who become one of the most powerful groups in the U.S. all the way up until shortly after, really into 1920s, they started to wane. And there was another group of pharmacists, independent pharmacists, that got together that ultimately became what's now called the APHA, the American Pharmaceutical Association. Those things came together, but they didn't really come together about the patient. They came together about preserving their business practices. And those groups weren't all that independent from each other. In fact, you had people like Andrew Carnegie and a number of other people.
Let's talk about that for a second, because we're going to have a lot of fun with this one in the next episode. I've done most of the prep for the next episode, and it's when our audience really, we talk about these patent medicines and what they did, where they came from, and what we ended up with today. That path is a very, very linear path. So a couple of points before we get into this, because I think it's really important that people kind of hear this. So in 1852, as you mentioned, the American Pharmaceutical Manufacturer and Dealers Association was formed. Sounds like today's drug gangs to me. In 1881, a group of the largest drug gangs formed the Proprietary Association of America. America's First Drug Cartels from your quote in your book. Quote, "They ushered in an unprecedented period of proliferating profiteering and fraud perpetrated upon the American people with disastrous results and many innocent victims." Some of the things we're going to get into this next session, we'll talk more in detail about this. But here, they were the drug cartels of the day, and they were supported by the newspaper men and the robber barons. So if you want to expand on that, we'll go into more detail this next episode. But I find this piece to be absolutely amazing. And when people read this, they'll have more wonderful cocktail hour and coffee table conversations to bring up.
Well, it is to a great extent the rise of the patent medicine man, the snake oil salesman, is one of the things that most affected the issues that we have in healthcare, in our healthcare system today. And it's very easy to subscribe all of their problems to the drug maker. And believe me, drug makers are not innocent in some of the problems that exist today. But the patent medicine men that really ran the show in the 1800s into the early 1900s, and some would argue all the way up to 1964 when the last of them finally got driven out of business. The patent medicine makers really were a powerful cartel that were supported by people like William Rockefeller, who was John Rockefeller's father, and we'll talk about him in just a second. John Rockefeller was the Standard Oil guy, and he became one of the most powerful men in America. You had J.P. Morgan, you had William Randolph Hearst, you had Andrew Carnegie, and a number of others. And these guys kind of got together, and Rockefeller and Carnegie and J.P. Morgan funded a number of these associations because it was good for business. It wasn't because they gave too much of a damn about healthcare. They were really focused on where it was good for business. But these guys were the cartel that Tim's talking about, the Proprietary Manufacturers of Association of America. They basically owned America for quite a while. The term lobbyist that we hear all about today comes from the name of the people that the Proprietary Manufacturer Association sent to the Willard Hotel in Washington, D.C. to get Congress people to work on passing laws. A couple of the laws they promoted was the Federal Patent and Trademark Act. Prior to the 1800s and the Proprietary Association, the trademark and copyright laws under the Constitution were administered in each of the states. Also, another law that was passed that had something to do with the impact of these people was the Sherman Act. The Sherman Act was the Antitrust Act, and we think that has to do with John Rockefeller and Standard Oil. Well, it does to some extent, but the first people they went after under the Sherman Act were patent medicine makers. In fact, Dr. Miles Laboratories was one of the first people ever sued under the Sherman Act. Miles Laboratories, again, we'll talk about later, but they created a product called Nervine, and we also know in the more modern era the version of it that's called Alka-Seltzer. But they started in the 1860s, and they did some things that caused the government to have a little bit of heartburn and went after them. To give you an idea how powerful this lobby was, the Proprietary Manufacturers Association in the mid-1800s owned over 80% or controlled over 80% of the newspapers and magazines in America. In fact, many of the modern newspapers we see today have their roots as what were called sell sheets for the Proprietary Manufacturers Association. They created these newspapers to bring a little bit of news and a lot of promotion of why you should take and use patent medicine. So it sounds a lot like drug companies and television and commercials today, but in that period of time it was even more insidious because they could build into everything they did those patent medicines they were trying to sell, and they became huge problems, to tell you the truth.
Yeah, I think it's interesting. You know the time frame better than I do. Today we talk about the opioid epidemic. I've seen that firsthand, and it's serious. I've got my own position on that because I've had to deal with pain doctors in my profession. It's a pretty serious problem. But let's kind of step back, and I don't know the time frame that you told me. I think it could have been into the early 1900s. We were treating children with morphine. if they wouldn't sleep, if they have colic, we were giving them morphine. That's what was prescribed to children. Many people were taking large doses of cocaine, along with heroin, and there was no labels on these products whatsoever. He wasn't just selling snake oil. He was selling, things to get you addicted. So at one point, I don't recall the estimate of the number of people in the United States that were addicted either to cocaine, heroin, or morphine. But I think you might have a better idea than me. I can't remember what was in my notes on that.
The thing about addiction in America is we think addiction today is worse than it's ever been in our history, and it's not true. Patent medicine started in England just about the time we started settling in America, but we became the purveyors of patent medicines very shortly after we started settling here. We're going to do a whole segment on patent medicines. We'll talk about that. But it was 1909, 1910 when the patent medicine era started to really shift because of a series of magazine articles in Collier's Weekly by Samuel Hopkins Adams. And he wrote a series of articles that kind of shook up the world. Addiction was a problem in the late 1800s. If you recall, there was a movement to ban alcohol and ban all kinds of things in terms of consumption that started then, and partly because by the time you got to 1900, over 30% of the population of America, many more women than men, oddly enough, were addicted to either cocaine, morphine, or alcohol. I'll say that again. In 1900, over 30% of our population was addicted to cocaine, morphine, and alcohol. The difference between that and the height of the drug years in the late 60s, early 60s, mid 60s to late 60s, only 18% of the population was addicted to any of those things. The difference is, in the 60s, we knew what we were taking. In the early 1900s, they had no idea what was in these elixirs that they were taking. So it really was a problem coming forward, and it was a series of steps in recognition of this that started to make change that caused these things to go away and to reduce the power of the patent medicine man in that period of time. So we talked about Samuel Hopkins Adams, but in 1912, we passed the Pure Food and Drug Act. And the Pure Food and Drug Act was established to start to force patent medicine makers to list the active ingredients that they had in these concoctions. To give you an idea of how effective it was, it took until 1964, from 1912, for the Food and Drug Administration to finally get Listerine, to stop saying they were a cure for the common cold.
I remember that like yesterday. I remember that advertisement when I was a kid.
No, any of us in our age group are going to remember that, and we'll remember Geritol, and we'll remember a number of other things that were almost all alcohol. My favorite alcohol story in Geritol is Geritol on the I Love Lucy show when she does a thing about Vitamita-Vegemin, which is clearly attacking the Geritol of the day. And she takes 2 or 3 tablespoons in doing this commercial, and she's completely drunk. Well, there's commercials from the 60s that are online, you can look them up, for Geritol that shows a very happy housewife wearing nice white gloves, greeting her husband when he comes in the door with a drink and a cigarette. And she turns to the camera, he puts his arm around her shoulder, and she goes, "I take Geritol every day, and my husband likes me this way." Well, of course, because by the time he got home, she was sauced. And, we've had an addictive nature to our culture for years and centuries, decades. But this kind of thing that happened with patent medicines coming forward has really caused much of the problem, and we're only now starting to get out of it.
Agreed. So one point, the percentages are high. As everyone knows, the population at that point was different. So on an absolute basis, the numbers may be a little different. But the fact of the matter is that these things were out of control. And then my research, to your point, they had to label the products. They didn't have to do anything else about it. And a lot of it wasn't because of the patent medicine. It was because of meat. People were selling rotten, crappy meat, and they were injecting it with all sorts of at one point they were injecting it with, what's the preservative? There's a preservative, what's it called?
Formaldehyde?
Yeah, formaldehyde.
Right.
So they were injecting that, they were selling it, and people were getting sick. So it started really with the sale of food and meat. It was expanded, obviously, when it was passed, but it didn't regulate it. And to your point, nothing was really done until 1962 to 1964. And then the pendulum swang in many different directions back during, the period of, we'll talk about that a lot, about the periods before that time and the banning of alcohol and things like that, which, by the way, didn't work very well either. Just like trying to ban marijuana right now ain't working so good either. But I think it's a fascinating story, and we'll go into the patent medicines in the next chapter because there's some incredible stories that are laughable, they're also sad, and it kind of gives you a grounding in just how out of control this was, and all for the set purpose of making money at that point in time.
Well, most patent medicines were only about making money. They had little to no medical benefit. In fact, some of them still exist today that way. And the more important thing is, a lot of the early patent medicines were actually exceedingly dangerous. I'll give you the first example of a patent medicine I was able to find, which is John D. Rockefeller's father, Wild Bill, William Rockefeller. William Rockefeller didn't build Standard Oil, his son did, but his claim to fame was he became Dr. Bill Rockefeller after John started to make some money and was embarrassed by his father and moved him to Chicago to live. Because when he started, before John was born, he worked in the oil fields of Pennsylvania. And people in the oil fields were out all the time. They got sick, they got broken bones, they got all kinds of problems. They were starting to see a rise of what we now would call cancer because they were around these hydrocarbons that potentially were carcinogenic. William Rockefeller, Wild Bill, started selling a product called Nujol, N-U-J-O-L. And Nujol cured cancer, it cured intestinal problems, it cured coughing, it cured the common cold. What was Nujol? Nujol was nothing but pure crude oil in a little bottle that he sold to the workers in the field. And of course, if you drink crude oil, it will kill you. And he sold that for quite a while before he realized that he was killing his own business, and he moved into some other things. And that's one reason that John D. Rockefeller put him in Chicago to hide him. And nothing has changed in many ways going forward. Many of the medicines that we've used since the early days have had their root as a poison. And that was the core of allopathic. To some extent, it is still the core of our system today that's based on allopathic medicine and germ theory and the concept of treatment that we have today.
So I think we'll wrap it up there. I don't want people to put the impression that all pharmaceuticals, we did go through a tremendous era of huge improvements in the manufacturing and distribution, and
that we did.
Some great. We'll talk about that a lot. There are some wonderful drugs out there that penicillin, as we all know, a lot of the antibiotics that we have today. So we went through a period of time of getting this cleaned up to produce some of the most incredible medicines that we have. I'm lucky that we had them when I was injured, and you as well. So. We'll talk about that later. One thing you did bring up was the invention or the discovery of anesthesia with ether, antiseptic principles. That changed everything. I didn't really realize it until I was in Boston a number of years ago and was taking a seminar on this. And it changed the principles of how hospitals became so predominant. Of course, along the line, we blew up a few operating theaters and things like that, but we made some improvements in that as well. The advent of technology, and we'll get into that. So I think it's a good segue because the hospitals started to gain, status. And I think, in particular, there's one quote I believe was from the book. So the rise in the status of the hospital and the patient and the patent medicine manufacturer set the stage for the battle over the control of medicine in the late 1800s. These battles would alter the basic principles of medicine and help lay the hazardous groundwork for the healthcare system we have today. So with that, next time, I'll get your thoughts, final thoughts. We'll get into more mainstream. We'll talk about medicine becomes an industry, where we'll dive more deeply into the patent medicines and the way hospitals have risen throughout the course of the history of the United States, and what we call the progressive era and its aftermath. So with that, I'm going to be looking out the beach here, looking for more whale sightings the rest of the afternoon, and turn it over to you to have your final thoughts, and I appreciate everyone listening.
Well, Tim, thanks a lot for joining us on this journey, and I want to thank the people that are listening to us for listening. This is a series of steps to get through the history, and we hope you will stick with us, because we are going to get into what all that means and how we carry it forward. There is so much in our modern healthcare system that has its root in our history. And this discussion today about patent medicine and the rise of the various associations and how the practice of medicine has changed between doctors and physicians may seem superfluous, but it actually has significant impacts on what we do today. So we thank everybody for your time. We appreciate you coming to listen to us, and we hope to see you in our next podcast. I'd like to also point out a couple of things. Number one is Tim talked about my book, and there's two of them. There's History of Healthcare in America. There's Delusional Ravings of a Lunatic Mind. They're both up on Amazon. Our podcast is now available on iTunes, Google Play Music, YouTube, Spotify. It just came up on Stitcher, and I got notice this morning we're now on TuneIn Radio. So people are adopting it. We're starting to get more and more viewers, so we would appreciate it if you like to go there and listen. Let us know. You can reach out to us by going to info@hr20.com. Yes, we have a new website name. We have two website names. Our old one is still there, but to make it easier, it's www.hr-20.com. And remember to subscribe, and you'll get notice of our next show. If you like the show, please hit the like button. That helps us move this thing forward and keep the lights on. And we look forward to seeing you the next time. So thanks a lot, and see you later, Tim. Enjoy the beach.
All right, Tom, I'll catch you this weekend.
See you. Bye-bye.